This
Okay,
conference will now be recorded.
so hello and welcome to the bi-weekly Tech Talk. My name is Ivan, as Oksana said. I'm actually currently the architect on the Centene team. I started as a tech lead, but got promoted. What can you say? The today's topic is actually not your normal tech talk. I'll be focusing on everything other than development, writing code, documentation, or even collaborating in meetings. We'll be talking about life in general and our health and well-being and how it's important to keep that up when working in the tech sector. So I'm going to share my experiences throughout my career and kind of explain how I view the things that happened and the choices I made and how I try to improve my experience and well-being. So this is your standard medical disclaimer. Don't try this at home. Talk to a doctor, talk to a physician. We are not responsible if you go drinking bleach after this presentation. So a little bit about me. I'm from Croatia, born in Zagreb, have roots on my father's side from in Dalmatia. I was one of the youngest subscribers to the Carnet public internet. Carnet is the Croatian Academic Research Network. And I got some kind of little booklet and plaque, not really a plaque, like a piece of paper, a certificate that I was the youngest member. This was even before it was called JMU, Javni Modemski Ulazi. So these were dial-up modems, your 56K. And then we got even the V90 56K, so we really took off, download speeds at close to 5 kilobytes a second. And those great sound effects every time you went on the internet. Uh, I started getting into Linux systems in high school. Was kind of interested, what was this alternative OS? So, I didn't have a Mac, I didn't have any Apple computer. I had a PC, and Windows was the only thing I could get for it. And Linux was, something you could try, relatively easy in terms of getting access to the software, not in terms of installing and using it. Uh, and so I went for it, and it was really interesting. And later, I also started playing around with the first smartphones when they came out, and the Linux experience came in handy because, as you all know, Android is based on the Linux kernel. Uh, Apple is not, and Apple closed itself really quickly up after the first couple of generations. Went to math and social sciences focused high school, but I opted for the social sciences afterwards. I enrolled at CEU, that's Central European University in Budapest, for my master's degree. I did my bachelor's in Zagreb, and it turned out to be a great education. CEU is currently ranked pretty high. It's number 24 in the world. So, it's comparable in results to the American Ivy League. And it's currently moved from Budapest to Vienna in Austria. I started getting into software development after university. During my master's studies, I realized I wanted to work in tech, and coding seemed to provide a good job if you're a knowledge worker. I had always this kind of mindset that I wanted to be a knowledge worker, and the tech sector, proved to be a place where you could earn well, and your skills were what counted most. You didn't have to rely on knowing somebody. And I've been developing professionally for at least the last 7 years. And by that I mean, receiving a salary or payment for my work. So the dangerous life of a developer is, I've been told, a dramatic subtitle. It is, but there are some risks inherent in our job. You're unlikely to get hit by a brick falling on your head or even run over by a car unless it's on the way to work. Um, but there are some risks, and there are some factors that increase those risks as we go along. So it's of course a sedentary job, and you're expected to sit for long hours, and this can cause certain issues. We've all gone to standard workplace safety seminars. I expect and pass some certifications. about using ergonomics and sitting upright and exercising. And why? Because you can get these mechanical issues like spinal degeneration or nerve compression, and biochemical issues relating to stress and blood sugar, caffeine intake, and ways these are basically uh, tools or ways you compensate for you want to keep your performance up uh, while keeping the downtime low. Ophthalmological issues. So this is why I have these, which I'm going to put on right now, my blue screen glasses. Uh, and these factors, they can slowly turn your life, downgrade your quality of life, and you can have these things that are called vicious cycles, basically. So these can impact sleep, and as you start getting lower and lower on sleep, on quality sleep, they can worsen those initial issues. And then you have situations where people quit abruptly, or they go for long sick leaves, and people call this burnout. There have been I remember a lot of articles about why is this happening, why is employee churn so high, is this a mysterious phenomenon? It's not, it's just a complex phenomenon. So how does this happen to us? So I mean, as developers, and I think generally staff in the tech sector, there's an expectation that we're recruiting the best and the brightest, and we are a gathering point for a lot of intelligent people. So how does this happen? Why would anyone make choices that end up hurting themselves and causing damage to their body in the long run? Because I mean, an assumption here is that we all make rational choices, but they can still lead us to states of compromised rationality. And there's also a trade-off between the short term and the long term, which of course means that when that long term comes into play, we will have problems. And here's how I try to explain why these things happen. So one is this kind of job, which is an elite job. And it's a select group of people, and it's a no risk, no reward environment. And this can lead us to stressful situations, which when you're not dealing with stress properly, you can get even into these states of fight or flight, as some kind of maybe psychologist or biologist would say, in which you have this adrenaline rush and your body's having a similar response as when you're faced with a physically dangerous situation, such as hunting, combat, or a potential accident. And what happens is when you're in these stressful states, your attention shifts away from the long term into the short term, and your choices are oriented toward optimizing these short term outcomes. And of course, these stimulants that we often use, that everybody uses, like caffeine and high sugary foods, can also exacerbate that. Nicotine, for instance. And then you have, of course, everybody wants to relax, enjoy themselves, go to sleep. So we also use foods and chemicals that kind of bring that down, like ethanol, for instance. And this can, in the end, diminish our capacity to make good choices for long-term results. Some of the issues that I've had, and I have, spinal degeneration, and that's well documented, thankfully now, with MRI scans. Poor sleep, that's something I used to have. Occasionally it pops up again, but not related to health issues this time. Uh, I was overweight. I maxed out at 115 kilos, and I'm 191 centimeters tall. Constant fatigue and anxiety. And even though I was from a young age active in sports, I did a lot of sports growing up, and later in college I did distance running. I hiked continuously, and every summer break or every time I was on the coast, I would go for long swims, keeping myself active. So, what was the solution? Because I found myself reaching a critical point in terms of quality of life. Even though my career was progressing and I was making good money comparative to other people in my age bracket in similar situation in the country where I live. So uh, here we have a title that says the solution is holistic. I want to just explain what I mean by that, since that's a word that's many meanings have been ascribed to it. Not all of them are good. Uh, so what this means is, if you want to improve your quality of life in a sustainable way, you have to basically change all aspects or review all aspects of your daily life and habits. And change should be controlled. Otherwise, you will regress and fall back into those habits because you picked them up for a reason. So people are rational actors. You made those quote unquote bad decisions for a reason. They actually have helped you accomplish, reach some goals. So uh, just to get back on track here. So if you're an overweight, out of shape person, you won't do high impact intensity training 3 days a week. What you should do probably is just start walking more and reviewing and changing your diets. Going to bed early, just kind of uh, relaxing, doing light exercise, and improving your capacity to think slowly in the long term. One of the reasons I got to that weight level was, overeating definitely, and that's because for the demands of my job and my life, I needed certain ingredients, vitamins, electrolytes, minerals, and if you try to get them all through natural food, they also contain they contain energy and calories, and you end up being overweight. So if you want to cut down, you probably need to supplement because if you're when you start cutting your weight, you'll also be missing these vitamins and electrolytes, and you'll become either tired or get health problems, and it'll be easy to fall back into those old bad habits again. Because one thing that's important to note is our jobs are pretty different from what people have been doing before. That's one thing, and the other is we can now measure and we can supplement in a relatively cheap manner in comparison to what people could do 100 years ago. So we can kind of choose our destiny. We can have that boring desk job and not have those classic traits that were associated with such work before. So this is what I jokingly call the dark side. These are things that I take on a daily basis. Really nothing special. There are no nanobots or stem cells or steroids. It's just supplementing protein with whey, some sugar for after workout recovery, and your standard vitamins. And since I wanted to cut down a little bit on my meat intake, tryptophan and well, uh, carnitine is something that you usually get from meat, and this is something why vegetarians, if they're not informed about nutrition properly, can suffer when switching away from meat. But this is what I have currently. It's a lot, but it's not actually that expensive. You just need to read slowly and think about what you need and what maybe deficiencies you're experiencing. And this is when I try to get all that from food. So this is me at about 112 kilos at least. You know. So I'm going to opt for the dark side here. To do all these things requires a lot of, self-study and reflection. Either that, or if you have that amount of income and you can pay somebody to monitor you continuously, an expert in this field, go for it. I do not. So basically, you should get familiar with the following topics: electrolyte and vitamins. What role do they play? And the easiest way I kind of organized my thinking here is the deficiency. What happens when there's a deficiency? What happens when there's an overdose? In terms of symptoms. Also reading about hormones in the human body, not just the sex hormones, but there are a range of other hormones that impact your body and your ability to think in the long term. And carbohydrates or sugar, which always gets a bad rap. I mean, probably any food item or any food component has, but it's always a question of the right time and the right amount. One of the best ways to do these things is to get your biochemistry tested. Unfortunately, testing all these things can be quite expensive, and so doing that in short intervals is for most people not an option. It's also not available. Sorry, sorry about that. Yeah, so I'm gonna move on here. So the other things is definitely reading up on exercise that you can do anywhere and that carries a minimal injury risk. You don't need a lot of equipment because this is so. I changed my habits by kind of robbing myself of excuses. I chose things like jogging and running and cycling and swimming because they're available in my environment. And even if rain is falling, you can get equipment for rain. If it's not too cold, you can work around. So some people prefer gyms. That's okay. I'm more of the outdoor type, or I like doing body weight exercises, from stretching like yoga to things like calisthenics and some other type of strength or resistance training without heavy weights. And to keep yourself in balance, you need to figure out what's your calorie intake, your calorie consumption, and this of course varies according to your body weight, your sex, and activity. Thankfully, so in today's world, the smartphone, which is, we've all seen documentaries like I think about social engineering. What was that? The Social Game or something? I forgot. No, something else. But your smartphone can be a source of distraction, and it can cause you to get kind of this dopamine cycle of constant notifications and liking if you're focusing on social media apps in the wrong way. But you can control that. You can clear that up, and you can use your smartphone to help you maintain your long-term habits through things like calendars and to-do lists. And now you have also dedicated fitness and nutrition apps. So one of the points here is the efficient ways of calorie counting. Efficient, I mean requiring low effort for maximum gain, because if it's too hard, you're going to give up sooner or later. And for instance, now you have, I think there's that app called MyFitnessPal, and it's definitely not the only one that has a library of barcodes. You can scan a food item, it will import all the nutritional data, and you can make a decision easier, and you can record your decision and the calorie amount that you've consumed. And of course, health indicators here, which I mean, you need to know your body. Some of these things will show up as signs on your body, but also there are some tests that are cheaper, and you gain some insight from them, and you can do them easily. When there are some tests that you can do at home. So, to summarize, my solution was I use biometrics a lot. So I have like a Garmin smartwatch. I wear it. I try to wear it 24 hours a day. I take it off for charging, for cleaning, and I switch my wrists if my skin, starts to get too pale in comparison with the other areas of my body. Uh, of course, it's like kind of like using navigation or Google Maps. I'm going to temper it with my good sense and my subjective experience because that is important. Our experience can be misleading, but we need to take it into account nonetheless. And if it's unsatisfactory for a long time, that's always a red flag that something is not going as we planned. Um, and I try to read regularly about health and body chemistry. I try to even read peer-reviewed studies. I've gotten a good education so I can understand some of these concepts, and I try to learn about those that I don't. But in the end, I will ask an expert. I will ask a person that's gone to school specifically for those topics and has had real life on-the-job experience with those topics. So, continuing, one of the things that always kept me, at least that accompanied all my regressions into these bad habits was these kind of guilt trips that I could have, should have done better. And I try to replace that with causality. So, your body chemistry, your mind and body are connected. Your body chemistry will impact you. It will impact your mood. It will impact your decisions. So, where does the mind come in? It kind of helps us to step away and plan out our lives because we know how we respond to certain environments and stimulants, and we can try to get ourselves into a better position. So when all these factors play out, they play out in a way that's favorable to us, to our long-term goals. Uh, so basically, that's the idea. I have free will, but it's not limitless. If I don't take care of myself, I will reduce my capacity to make choices. Um, and So about alternative medicine, that's definitely something to be cautious about. But I'd say seek a scientific explanation. Everything obeys the same rules of physics and biology in the world, and you can then come to an understanding of sometimes why it succeeded in some cases, why it failed in others. These practices did come about out of good faith to try to improve the lives of people, and they have been in most cases supplemented with scientific methods that have based on instruments that weren't available before, gotten better insight. But that's not always the case because it's a big world to study, and we haven't studied everything yet. And based on this understanding, I try to spend my money thinking also about opportunity cost. That's a economics concept, meaning so not just thinking about the money I'll lose when I buy something, but also what would happen if I don't make that choice or if I'm prevented from making that choice. And thinking in terms of long-term benefits. Uh, One thing also that was kind of something a source of dread for me and preventing me from maybe from doing all of these things earlier is this kind of efficiency trap. So my career was going relatively well, even though my physical health was not. So my question was always, what if this lowers my productivity? What if I try to live healthy, I can't be as effective in my job. And so this is both, I mean, it's a source of money, it's my occupation, it's something I enjoy doing. And initially it might do that because once you cut things from your life, until you replace them with better alternatives, there's this period where you'll be maybe kind of on the lower end of your efficiency. But in the long run, everyone will confirm both your brain and body will function better, meaning you'll make better choices, you'll communicate better, and you'll be able to do more work because without getting tired, because your body will function better. Also, it's easy, it's important to think about how you measure your productivity. Focus, not just on formal criteria like a release or a ticket, but think about, uh, you know, you should have that feeling of quality when you make something. So you should have the feeling that I've done the right thing, even if maybe all of the numbers did not add up. Because our measurements in this area, so in terms of project planning and execution, are not perfect, and there are a lot of things we can't measure and we approximate. And there's always this famous saying from Facebook, move fast and break things, and that was definitely true when Facebook started, and it applied to their case. They were entering a completely new market at that time. They had close to zero competitors, and they needed to move fast to make sure those potential new competitors couldn't overtake them. Most of our work is not like that, especially I think a lot of us here are on health projects or health and biomedicine, and this is not an area where you want to break things. So if somebody doesn't get notification that somebody else liked their post, that's not as big of a deal as somebody maybe not getting a subscription for their uh, medication filled out. Uh, so I would say you should argue for your work and your contribution with data that you understand, measurements that you understand, and you should be prepared to defend that. So to listen to criticism and respond to it. Of course, we're all human and social beings, so we need our family support. We should consult with experts like doctors and get tested and do regular general checkups. And if you're trying to increase your physical activity, you should review training programs. There's also the option of personal trainers, depending on the way you like to do that. Some of the pitfalls, as always, it's not possible to measure everything all the time. There are interactions. If you're not an expert in a certain area, you can get you know, kind of caught up because some values which may be in standard, let's say a standard range in one context, may be dangerous in another context. Think here about biochemistry, for instance. And of course, experts and tests cost money and time. And everybody has a scarcity at least in one of these two, and most of us have it in both. Uh, Here are some sources that I use to get informed. Wikipedia, which started as a really low quality, almost forum-like thing, has slowly grown into something which has great articles that are written by experts from that field. it's a collaborative effort. There are still areas where there's low quality articles. There always will be, but you can usually spot good articles based on things like the sources they cite, the way the language of the article, how it's written, and that the article tries to stay away from arguing specifically on a point and tries instead to verify everything with empirical data. Other other sites I like to check out and read are the Mayo and Cleveland clinics. These are some U.S. clinics that offer uh, free health articles that are geared toward the general public, not a doctor or a medical professional. And it's a great way to learn about some of the topics I mentioned from before. The NHS, that's the UK public health system, also has some sites that deal with those topics. There are some even from my own country, based on language you can select from yours. But no, so I think there are a lot of great sources, and I think it's just important to follow these basics. So look for sources and look for authoritative quotes and research and testing. This is the end of my presentation. I would ask Oksana now to read questions if there are any.
As for now, we don't have a question in the chat, but perhaps people would like to ask in person. Anyone?
I have a question. So, what kind of blood work have you been doing? Hormone levels or
Yeah,
micronutrients?
I've done hormone tests only in situations where it was obvious that something was wrong. I don't do them regularly because they're usually expensive. What I do regularly are the standard blood testing that you do that includes something like glucose levels, sodium, potassium tests for diseases like platelet counts. The standard blood panel. Unfortunately, so testing for vitamin levels or electrolyte levels, some of them are cheap, some of them are really expensive. So I don't want to fork out €1,000 to do to get all of my hormones or all of my electrolyte levels measured, especially not regularly. So what I try to do here is compensate by looking at science on my own body and experience. And if I strongly suspect that it might be so, after consulting with my doctor, I will pay for that more expensive test or try to get it through the public health system if possible.
Thanks.
I also, I pay for all free, so for all two additional Croatian healthcare levels. So besides the mandatory insurance I'm paying for the dopunsko and the dodatno, and this also has some advantages. At least the third one, I can get some tests like some MRIs and some blood work included there. That's a good question, Dubravko. So I think at this point I'm pretty much it's ingrained every day. It's something I think about, and I feel bad without exercise. I guess you could call it a form of addiction. But so basically, once when I was starting, I kept myself motivated by, I knew I was in good shape before. I wanted to get there again. And I used things like my smartwatch and my phone to keep myself regular, to keep reminders. And also, one of the great things about a smartwatch, it's now a substitute for a training journal. Now, that's something I used to actually keep on paper when I was younger. And now you get all of that on the smartwatch, and you get your heart rate measurements and other things. So I think if you want to keep up your exercise, one of the most important things, at least in my mind, is as you progress, a couple of months or more, is to actually keep yourself from burning out from exercise or injuring yourself. And these devices have gotten better at measuring your energy levels and measuring other indicators of physical stress. So, for instance, I have this Garmin Fenix 6. It's not the latest one, but it's gotten upgrades where it can now follow your heart rate variability, which is something that usually would test when you wake up in the morning, you do a measurement. Now this measures it throughout your sleep and day period. And it's actually a pretty good measurement of when I exercise too much. So once it starts showing imbalance after, let's say, 2 or 3 days of strenuous exercise, I'm going to listen to that. I'm going to either take light walks or just do some really slow bicycling around. And it works. I recover and I have that same urge and that same, exercise becomes fun again. Because if you burn yourself out, exercise is not fun. It's painful. It's a chore. You want to puke, and then at that time, people kind of just quit. I hope that answered the question.
Any other questions?
Oh yeah, calorie intake. Okay, yes, Dubravko. Okay, that's correct. So this is why it depends on where you are in your life, or actually where you are, regarding with your weight. If you're it depends, if you're overweight to a great extent or underweight to a great extent, uh, you can probably measuring will help you. Measuring regularly will help you with keeping realistic goals to make progress. Once you get closer to your optimal weight, you can kind of take it a bit looser. But the caveat here, between rigorous measuring and just ballparking it is, I measure my weight regularly. I measure it daily. I use a smart scale. It's uploaded and saved. I see I have a graph of my weight and body fat too, but it's not really accurate to do it that way. It's just like a ballpark figure. And this is, so I see if okay, I'm kind of in an upward trend and it's going to cross some threshold that I don't want to cross. Okay, now it's time to maybe watch it again and to take care. But yeah, if when I'm strictly calorie counting, I do something like MyFitnessPal, and I just so I know I'm eating. If I'm eating something like a yogurt container, it just scans. There's a calorie amount, and you can multiply or do a fraction of it to get your calorie count. It's a little bit trickier when you're making a complex meal, like you're making lunch with many ingredients. You have to measure those ingredients and then put them all on the table and account for all of them. But I definitely, either way, I always try to measure the ingredients that I use when making food, and it's something that helps a lot. It can, it's important, even if it just raises your awareness that how much an extra cup of oil how many calories will it bring. You're welcome.
Looks like that's it. Thank you, Ivan, for sharing your experience. Hope it
Yeah,
will be
thank you.
motivational for our colleagues to have a balance, to have rest, to use vacation. Thank you.
Yeah, you're welcome.